Good afternoon, everyone, and welcome to the regular meeting of the Public Health and Safety Committee for January 4th, 2023. I am Latricia Vitaw, and I'm the chair of this committee. At this time, I will ask the clerk to please call the roll so we can verify a quorum for this meeting.
Councilmember Wansley.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Payne.
Present.
Chair Vitaw.
Present.
There are 5 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. First, we have the consent agenda before us. There are 9 items on today's consent agenda. Item 1 is authorizing the submittal of a grant application to the Minnesota Division of Homeland Security for emergency management. Item 2 is authorizing the submittal of a grant application to the Minnesota Division of Homeland Security for the Urban Area Security Initiative. Item 3 is accepting a grant from the Minnesota Department of Health to administer the Minnesota Personal Responsibility Education Program. Item 4 is the passage of a resolution appropriating funds to the Health Department for biochar production. Item 5 is accepting a grant from the Centers for Disease Control and Prevention to develop foundational public health infrastructure. Item 6 is accepting a grant from the Day Beaumont Foundation for innovative multi-sector partnerships for community transformation and public health. And item 7 is authorizing a cooperative agreement with Hennepin County for Youth Group Violence Intervention Initiative. Item 8 is approving appointments to the Community Environmental Advisory Commission. Item 9 is approving appointments to the Workplace Advisory Committee. And item 10 is receiving and filing that's in the wrong spot, but we'll receive and file when we get to that. Are there any discussions on this item? Councilmember Wansley.
Thank you, Chair Vitaw. I actually had a question related to item number 5, which is the public health infrastructure grant for the CDC. Do we have a staff member? Thank you.
Hello and welcome.
Hi. So I just want to first say, I'm really excited to see that we have the possibility at the city to receive, a little over $6 million for supporting, our public health workforce and hopefully increasing our capacity to meet public health needs. But I wanted to get a little bit more information about, what the health department intends to do with this grant if we're awarded. If you could share a little bit about that.
Sure. Thank you, Chair Vitak, Co-Chair Payne, and Councilmember Wansley. So we actually have received, so we're accepting the award. We have received, this was a grant that CDC developed, and it's based on a formula. So for Minnesota, only the State Health Department and the City of Minneapolis were able to apply, and it's in response to really the COVID pandemic and what they saw, what we saw as the lack of funding that public health had been receiving and the loss of funding public health had received over the years, and how our infrastructure was not ready to respond to COVID as it was. And so this is an unusual grant in the sense that it's not disease specific. CDC, most of their grants are disease specific. This is not disease specific, and it's really focused on increasing the infrastructure of public health. So for our health department, part of it is really looking at our staffing and ensuring that we have staff that can respond. One of the things we saw is that, we had to do a lot of contracts for our vaccination clinics and for responding in that way because we didn't have staff that could do that work. And so part of the grant will be to look at hiring a couple of public health nurses that will be within the department that will allow us to continue our work around immunizations, not just related to COVID and flu, but all pediatric immunizations, for example. We also are looking at developing programs to create pathways for young people to come into public health. So looking at developing a program that will place junior and seniors in high schools within the health department over the summer to experience what public health is all about, as well as undergraduate and graduate students that are already maybe interested in public health or starting their coursework in public health to be with us over a course of a year and be engaged in developing those programs. We're also looking at a public health institute based on our blueprint-approved institute that we've done through the Office of Violence Prevention, but looking at doing more general public health prevention work. So hoping to fund 10 organizations each year. They would receive training and a seed, about $10,000 in seed money to do a project as they're going through that training. So really trying to develop both our partner infrastructure within the city as well as our staffing infrastructure.
Yeah, thank you for providing some of that information. I'm really excited to hear about the pathways, especially as someone who have the University of Minnesota, in my ward, which has a robust public health program. So super excited about that. I will also ask, reason why I asked for some of the parameters of, how this funds will be used is I didn't see the grant application attached to the RCA and LIMS, so just also wanted to see if there's a way to either get the
Sure.
PDF file or executive summary, working with the clerks to get that up on LIMS too.
Sure.
Awesome. Thank you.
Okay. Any other questions?
Thank you, Madam Chair. You actually answered a lot of my workforce questions, so I'll just refine my question to how do you plan on engaging with young people, students, in terms of getting them into the pipeline for this program? And is there anything that we can do to help spread the word for this program? And maybe what's the timing of when all these activities might start?
The grant just is effective as of January 1st. We have to submit a revised budget because there were some changes. We're hoping to hire someone that would be managing that program, and then we're hoping to work with the folks that run Step Up and some of the other programs that the city already does to look at what is the best way to do it. And then once we have sort of more defined plan, we would be posting positions and working with high schools. And so at that point, we definitely would hope that you guys could send out within your newsletters and to have that publicity of the program. But at this point, we don't have all of those details worked out. The grant proposal was due early, last year in September, and we just found out about it about a month ago. So just haven't started developing all of the details. So we have a broad outline of what the program might look like, really modeling after Step Up and some of those other projects that already engage with high school students. And then some of the urban scholars being sort of the one that engages with undergraduate students.
That's really exciting. Thank you. Thank you, Chair Vita.
Councilmember Rainville.
Thank you, Madam Chair. Would you have a sense of how we're doing with our pediatric immunizations? I know we had a measles outbreak last year. How are we doing as a city with our children?
So thank you, Councilmember Rainville, for that question. So with COVID, we already had challenges within our pediatric immunizations in certain areas, in certain communities, in terms of reaching the levels that we really would like to see. And with COVID, those really took a beating. So we are not where we want to be, and we haven't seen the increases even as people have resumed fairly normal lives. Seen the catch up. So we are actually doing some work to engage with partners to look at doing clinics for catch up immunizations, but particularly MMR, we are very low, and that is a concern. And we saw a measles outbreak earlier in the fall, and that is always a concern for us because it has large impact. When someone is not immunized, they may have to stay home for 21 days. And so that is a very, it's hard on the families and on the kids. So.
Thank you for keeping an eye on that. I appreciate it. And thank you for coming today in a snowstorm.
Glad I could be here. Thank you.
Thank you. I have a question for Director Peterson about item 7. Just maybe, could you provide an overview of exactly what this partnership with the county is, and if there's like an RFP process or who you've worked with previously on this funding?
Certainly, Chair Vita. Josh Peterson, Interim Director of the Department of Neighborhood Safety. So this cooperative agreement here is for Hennepin County to give the city $150,000 to help us operate our Youth Group Violence Intervention Initiative, YGVI. So as I think you know, we've been working on our group violence intervention strategy since 2017. We've recognized that though those services have been really impactful, there's a gap in services for young people, a gap in particularly developmentally appropriate services that can focus on group violence. And so YGVI is intended to fill that gap. Through YGVI, we intend to partner with a number of youth-serving jurisdictions, so folks like schools and parks, and certainly Hennepin County as well. Hennepin County serves young people, particularly through juvenile probation. So we've been working with them to develop this partnership, and as part of that partnership, they wanted to help fund the initiative, so that's what this money is for. We anticipate the money going to our support and outreach providers that we use through GVI and YGVI. We do an RFP process for that. We actually did an RFP just closed about a month or two ago, I think. So we anticipate using that RFP and the providers that were identified through that RFP as the service providers for YGVI and the service providers who would be using this funding. Does that answer your question?
It does. Thank you so much, Director Peterson.
You're welcome. Thank you.
Thank you. I think I've actually made a mistake on the agenda. Item 10 is not going to be a presentation, correct, clerks? Okay, it's just a receive and file. So to my colleagues, I just want to add, item 10 is receiving and filing the Northside Green Zone Task Force appointments report to our agenda. Is there any more discussion? Seeing none. Oh, I'm sorry, Councilmember Wansley.
Thank you, Chair Vita. Do we have someone here who can speak to the green zone? Okay. You're just coming up.
Speak to it. Unfortunately, the staff that would be speaking to it was not able to make it in due to the snow, and so they are very willing to follow up with you with any questions. But at this time, I don't have the knowledge to speak to it. I just wanted to let you know that.
Well, I will then direct my request into the chairs of this committee. If there is a way in which we could get a presentation on this item at our next PHS meeting, I think the topic of green zones has been very prevalent all last year, and really want to get clarity around metrics of success and goals for that initiative. So would love to have a deeper conversation on this particular thing.
I am 100% committed to getting us a presentation. I'm just not sure that that will be in the next PHS committee. What I will do, Councilmember Wansley, is work on making sure we get a presentation if something is available for us in committee. But I don't know about the next one.
Okay. In any time possible.
All right.
Yeah, that'd be great.
Okay, thank you so much. Seeing no further business before us, I'll move approval. Seeing no further discussion before us, I'll move approval of the consent agenda. All those in favor, please say aye. Aye. Those opposed, nay. That carries, and the consent agenda is approved. Seeing no further business before us and without objection, I will declare this meeting adjourned. Thank you, everyone.